Hey guys, it's Steph Sco Physio at Active Care Health in Kelowna, BC. What I'm going to be showing you today is an exercise called a muscle energy technique, which may help with pain around the SI joint when you have an anteriorly rotated innominate bone, that's the pelvic bone, on that side. So what I'm talking about is if you have pain through this area and your forward side is that side, or sometimes your forward side is that side and you have pain on the other side. This also will be effective as long as you're doing it in the right direction, which is easy to tell because it will relieve your pain if it's in the right direction for you. So what you do is, if your right side is your anteriorly rotated or forward side, usually it's the higher side, and usually you can see in a mirror that you're forward on that side. So what you do is your right leg goes forward, your left leg goes behind you. First option is to just lean into a slight stretch like you're stretching your left hip flexor, but instead you're going to push down with your front leg to activate the glute and the hamstring. So you're pulling your heel into the floor. What that does, in theory, is rotates your innominate bone, your pelvic bone, backwards. And then you pull your left leg forward into the floor, which in theory anteriorly rotates your left innominate. So that's option number one. For myself, this is most effective when I put a little more effort and weight into it. So I actually hover and do the same thing, push, and I hold for about 30 seconds till I get a little bit of a fatigue in the glute and the hamstring on the affected side, because my SI joint on the right is usually sore and it's usually anteriorly rotated. So this helps me between chiropractic adjustments if I'm having pain. And then I rest after 30 seconds, do a gentle stretch, keeping a neutral spine, my abs are engaged. Rest a few seconds, and I go back into it, activate everything, left hip flexor, right glute and hammy, push. After about 30 seconds, I rest again, and I repeat that 3 times. So often I would do that before or after a run if I'm having a little bit of a SI joint irritation, in between manual therapy, either with a chiropractic adjustment or a physio that would do a similar sort of mobilization or manipulation of the pelvis. There you have it, a self-exercise, a self-fix for SI joint pain.